Hi, my name is Mallory Little, and our group is going to talk about the prevention of communication disorders, and I'm going to let my group members introduce themselves. Hannah Cade.
Hi, I'm Megan Marshoni. And I'm Victoria Stewart.
Okay, so we'll get started. Since you are the caregiver of your grandchild who is in kindergarten, we're going to be talking today about communication disorders. Hopefully by the end of the presentation, we will have answered some questions for you. And those questions are, what is language? How does language develop? What do I do if I notice delays in my child? What do I do to prevent a communication disorder? Okay, so we're going to start by talking about what language is. Language is the way that humans communicate with each other. It can be through spoken language, which would be speaking to each other, or written language, and also signs, such as American Sign Language. So today for our presentation, we're going to be focusing on speech and written, but mainly speech. The 5 areas of language are phonology, morphology, syntax, and semantics and pragmatics. And phonology is the sound system of a language. So problems with this area usually present in the form of omissions, extra sounds, and substitutions. Also, any sounds that are distorted, such as a lisp, would be a problem of phonology. These disorders are usually classified as a speech sound disorder. Morphology is looking at the different parts that make up words. So for children, specifically children with language impairments, morphology can be an area of difficulty when forming plurals by adding s to words, changing tenses by adding endings to verbs, and prefixes and suffixes are also a component of morphology. Syntax is the way that words are combined into phrases and sentences and that are grammatically correct. So children speaking in fragments or run-on sentences or with unusual word order would be a syntactic issue. Semantics deals with the meaning of words, and with children with language impairments, they usually have trouble with synonyms, antonyms, and homonyms. Synonyms are words that have the same meaning, such as big and large. Antonyms are words that have opposite meanings, like big and little, and homonyms are words that sound the same but have different meanings, such as there, as in the possessive form, and there, as in there, like over there. Pragmatics is the social use of language, and children speak differently in different social situations. So some examples of pragmatic issues would be when a child standing too closely to someone while speaking, constantly interrupting in conversation and not allowing turn taking, or talking to adults the same way that they talk to their peers. Language. So the next question we're going to answer is, how is language learned? Learning language is gradual, and it occurs through interaction with people and their environment. The preschool years of a child's language development are some of the most important. And as your child is in kindergarten, these are some important times for their language development. Developmental milestones are a good way to see what is typical for a child's development. But you can't refer to those as hard and fast rules, because children are different, and though your child may be slightly delayed in one area, that's not to say that he's not excelling at other areas and that a language development is absolutely there.
Okay, so next we're going to look at some language milestones that kindergartners should be doing. We're going to look at milestones for listening, speaking, reading, and writing. So the first one, listening. By kindergarten, a child should be able to follow a 1 or 2 step simple directions in a sequence, such as pick up a book and come sit in the chair. They should be able to listen to and understand age-appropriate stories that are read aloud, and they should be able to follow simple conversation. They should also be able to understand what is being taught in class. Next, some milestones for speaking that kindergartners should be able to do are they should be able to be understood by most people, and they should also be able to answer simple yes or no questions like did you eat lunch, or more open-ended questions like what did you do at school. They should be able to retell a story or talk about an event by talking about the things that happened during the day, and they should participate appropriately in conversational dialogue. They should show interest starting conversations, and they should be able to engage appropriately. Next, some reading milestones. Kindergartners should know that reading a book in English occurs from the front to the back, top to bottom, and left to right. They should understand that spoken words are made up of speech sounds, and they should also be able to identify words that rhyme, such as cat and hat, book and look, and such. Kindergartners should know that some words have the same sounds in them, like sun, soup, and sand. And they should understand that letters represent speech sounds and be able to match sounds to letters. Kindergartners should also be able to identify upper and lowercase letters, and they should know sight words such as the, cat, with, just to name a few. They should be able to imitate reading by talking about books and pictures, and they should be able to tell a story by looking at pictures in the book as well. The last milestones we'll look at are for writing, and kindergartners should be able to print on their own their first and last name and draw a picture that tells a story, and then label what they label and write about that particular picture. And they also should be able to write upper and lowercase letters clearly.
Okay, so now that Victoria has discussed the milestones for the kindergarten age, I'm going to focus more on the broad ages from kindergarten to second grade. So throughout kindergarten to second grade, children's abilities are becoming much more complex. They should be able to understand and use more sophisticated language forms. Children's language skills become this way because they are using more correct grammar and more variety in their vocabulary. Children at this age also think and understand more complex concepts, which naturally makes them want to express more complex ideas. At this age, a child at this age is also better at interacting socially with his or her peers and adults. Their desire to be part of an adult conversation and behave more like an adult is also increasing. So the following slides are going to discuss expectations of children's language in kindergarten through second grade regarding receptive language, which is what the child understands, expressive language, which is what the child says, phonological awareness, reading, writing, and social play. First, we have receptive language. After the second grade, children should be able to follow 3-step directions and multi-step unrelated commands. So an example of this would be walk to the door, say hello, and then cross your fingers. They should also answer more complex questions such as who, what, where, when, how, and why. They should listen to and understand grade level stories that are read aloud to them. And they should demonstrate listening comprehension by recalling information and responding to instruction. Impairments in a child's receptive language can result in problems with understanding what gestures mean, following directions, answering questions, identifying objects and pictures, and taking turns when talking to others. Okay, for expressive language is what the child says. So after second grade, children should use the preposition above, use most parts of speech, grammar is mostly acquired, begin to master exceptions to grammatical rules, use and understand passive sentences, express ideas with a variety of complex sentences, Ask and answer factual and probable questions. Give directions and use a variety of words. And impairments in an expressive language can happen if a child has trouble asking questions, naming objects, using gestures, putting words together into sentences, learning songs and rhymes, using correct pronouns like he or they, and knowing how to start a conversation and keep it going. For phonological awareness, children ages in kindergarten through 2nd grade should be able to match all sounds with the written letter and name. So they would know that a T sound or T makes the T sound. And they would understand alliteration. They can identify words beginning with the same letter, such as Mike's microphone made much music. And their rhyming solidifies. They know the onset or the beginning sound that changes and the rhyme or the last part of the word that rhymes. An example of a rhyme is park and bark. And for blending would be taking butter and fly and putting it together and making butterfly.
Expectations for reading include creating words that rhyme, blending separate sounds to form words, identifying all sounds in short words, matching spoken words with print, reading words by sight, applies knowledge of how print is organized, and reads 60 words per minute. Expectations for writing include expressing ideas through writing, printing clearly, spells frequently used words, beginning sentences with capital letters and uses end punctuation, and writing a variety of short compositions. For social play, the child should start and take turns in conversations, stay on topic, and use many types of expression to express their needs and wants. So, what are the signs of a language disorder? They can include problems understanding what others are saying, problems saying words and sentences, having a small vocabulary, having trouble thinking of words, or problems with reading and writing. Some risk factors for language disorders include a family history of speech and language problems, ear and hearing problems, premature birth, low birth weight, children with autism or intellectual disabilities, and prenatal exposure to alcohol. So how can you prevent a language disorder? Be knowledgeable about typical language and speech development. Talk to and read with the child regularly. Have the child's hearing checked regularly. Reinforce communication attempts, including gestures and partial verbalizations. Use storybook sharing, which is reading stories and eliciting responses about what is read. Ask open-ended questions. Encourage reading and writing daily. Provide fun activities that are functional and practical. And make sure the child wears a helmet and seatbelt to prevent accidents that can cause brain injury. And also, there's an activity you can do with your child or your grandchild that involves chores. So chores build confidence and ability in the child. So you can break down the jobs into smaller steps, like a sequence, and explain what to do step by step until the job is done. Always provide help when it's needed, and praise when they do a good job.
Another example of something you could do would be to play simple games while you're driving the child to school or to the grocery store. You could play I Spy. This would require the child to generate questions such as, is it the fire truck? Is it the car? And as well as generate just simple statements, I spy something green. So that would be an easy game that you could play with your child that would facilitate language development. So one of the most important things you can do with your child to facilitate language development and prevent a communication disorder would be to read. Reading is very important. You're your child's first teacher, and it becomes even more important for you to read every day to your child if you think that their language may be delayed, because language development is closely linked to learning to read and write, and so any way that you can facilitate that literacy or language development will help your child, in reading to them every day would definitely facilitate that language development. And also, just the way that you talk to your child can help develop their language. So always try to use clear, simple speech that can easily be modeled, and give your child the opportunity to talk or answer back to you. Don't just talk at them. Like Megan said, ask open-ended questions that require them to formulate sentences and longer answers than just yes and no. Play rhyming games with your child. Little sing-songy type rhyme games are very good to help them be aware that words do rhyme, and help them be more aware of the different sounds in words. And most importantly, just acknowledge, encourage, and praise all attempts to communicate, even if they're not perfect the first time that it comes out. You always want to encourage them to communicate, and even though you make corrections, do so in a way that the child continues to want to communicate.
Okay, so what should you do if you think your child may have a language problem? The most important thing is to trust your judgment. Parents, grandparents, and caregivers are critical to identifying children who are at risk for speech and language disorders. Even though they are concerned that their child's speech and language development may be unusual or slower than normal, some people might hesitate to seek professional advice of a speech-language pathologist. And sometimes this can be because they're advised against it by reassuring friends or family members, or maybe it's because they think that their child is too young to be assessed, but it's never too early to seek help and have your child assessed by a speech-language pathologist. So when to seek help? Seek help if you're concerned about your child's language progress, and you can do this by looking for a speech-language pathologist. Any speech or language problem is likely to have a significant effect on a child's social and academic skills and behavior.
So how can you find an SLP? Your local school district is responsible for all special education services, including speech therapy, until the child graduates from high school. You can call the special education department to set up an evaluation, or to find a private therapist in your area, go to the American Speech and Hearing Association's website and click Find a Professional. So what can an SLP do? They can administer tests of receptive and expressive language. They can analyze a child's utterances in different situations. They can determine factors that may be slowing down language development, and they can counsel parents on the next steps to take. And here are our references.